it's just really hard for me to even ask you this question because I'm almost in disbelief. If a baby is born on a table as a result of a botched abortion, what would Planned Parenthood want to have happen to that child that's struggling for life? You're recognized.
Thank you, Mr. Chairman. Well, we believe that any decision that's made should be left up to the woman, her family, and the physician.
Okay, Chair Davis, and then we'll come back to you, Rep. Oliva.
Thank you, Mr. Chairman. And I believe you were in the committee room whenever I asked Representative Pigman the question about what happens in a situation where a baby is alive, breathing on a table, moving. What do your physicians do at that point?
You're recognized.
I do not have that information. I am not a physician. I'm not an abortion provider. So I do not have that information.
Follow up. Go ahead, sir.
I understand that you're not a physician, but you do represent
Yes.
Physicians who do perform this activity. And can you tell me what happens when a baby is alive on the table? At that point, what do they do with the baby that is struggling to live?
You're recognized.
I don't know, and as it's been referenced earlier, we don't know even how prevalent this situation is.
I don't know how else I can get an answer, Mr. Chairman.
All right, well, we'll go to Representative Oliva for his question.
Thank you, Mr. Chairman. Along the same lines, you stated that that a baby born on a table as a result of a botched abortion, that decision should be left to the doctor and the family. Is that what you're saying?
It should. Thank you, Mr. Chairman. That decision should be between the patient and the healthcare provider.
Go ahead, sir.
Thank you, Mr. Chairman. I think that at that point, the patient would be the child struggling on a table. Wouldn't you agree?
You're recognized.
That's a very good question. I really don't know how to answer that. I think, I would be glad to have some more, conversations with you about this.
Thank you, Mr. Chairman.
Representative Cleland for a question.
Thank you, Mr. Chair. If the law doesn't speak to a physician's obligation in an abortion clinic setting, then what conflict do you have here? You mentioned in your testimony that the law already speaks to that, but if it doesn't in the abortion clinic setting, what issue do you have with that being codified in this bill?
You're recognized.
Thank you, Mr. Chairman. Okay, I'm not sure I understand your question.
You can rephrase it.
Thank you. From what I gathered from your testimony, physicians have an obligation already under the law to provide advanced life support to a child born alive. But if the law doesn't speak to that in an abortion clinic setting, and I think the bill sponsor, who's a physician, testified that it doesn't, then what issue would you have with that being in the current bill?
You're recognized.
Okay, are we talking about my reference to the federal law?
I suppose so, yeah.
Okay, because I just want to be clear. We support the neutrality clause that was in the Federal Born Alive Infants Protection Act of 2012, which has been addressed.
Follow up, Mr. Chair. Does that address the obligation of a doctor in an abortion clinic setting to provide advanced life support to a child who was born alive in an abortion?
No, the neutrality clause addresses the situation where this particular language can't be extrapolated out through other, statutes dealing with abortion. It just deals with this particular area.
Okay.
So,
sorry. Notwithstanding that, does Planned Parenthood have an objection to a doctor being obligated to provide advanced life support in an abortion clinic setting to a child born alive? I mean, I guess you do, or you wouldn't be here, right?
You're recognized.
thank you, Mr. Chairman. Let me just pause and say where our opposition remains. Okay, and then maybe that can answer some questions. We have serious concerns about the surrender wording in this. The second piece is, as you all discussed earlier, was the transport to the hospital. we would like to be in a position to remove our opposition. And again, Representative Pigman has been great to work with. He's been very friendly to us in terms of some language that we were trying to seek. So I do want to give him kudos for that.
One final follow-up, Mr. Chair. I appreciate the indulgence. What objection could you possibly have to obligate a doctor to transport a child born alive to a hospital, where it seems to me they would be most likely to be able to survive?
You're recognized.
Thank you, Mr. Chairman. What about those, and I'm just speaking out loud here, what about those situations where it's in a rural healthcare setting, the hospital is 45 minutes, an hour away, that's the closest trauma center or emergency room. There's just some logistical issues involved that we've got some concerns about.
Okay, thank you very much.